Hi, I'm Dr. Andrio, Professor of General Surgery and Alternative Surgery. Let's talk about alternative medicine, more specifically, acupuncture. Naturopathy, also known as naturopathic medicine or natural medicine, is an eclectic alternative medical system that focuses on natural remedies and the body's vital ability to heal and maintain itself. Naturopathic philosophy favors a holistic approach and minimal use of surgery and drugs. Naturopathy comprises many different treatment modalities of varying degrees of acceptance by the medical community. Diet and lifestyle advice may be substantially similar to that offered by non-naturopaths, and acupuncture may help reduce pain in some cases. But homeopathy is often characterized as pseudoscience or quackery. Naturopathy has its origins in the nature cure movement of Europe. The term was coined in 1895 by John Shiel and popularized by Benedict Lust, the father of U.S. naturopathy. Naturopathy is practiced in many countries, especially the United States and Canada, and is subject to different standards of regulation and levels of acceptance. The level of medical education among naturopaths also varies, though no naturopathic training program reaches the same level of training as an M.D. or D.O. in the United States and Canada. The designation of naturopathic doctor, ND, may be awarded after completion of a 4-year program of study at an accredited naturopathic medical school that includes the study of basic medical sciences, as well as natural remedies and medical care. The scope of practice varies widely between jurisdictions, and naturopaths in unregulated jurisdictions may use the naturopathic doctor designation, or other titles, regardless of level of education. Some see the ancient Greek father of medicine, Hippocrates, as the first advocate of naturopathic medicine, before the term existed. The modern practice of naturopathy has its roots in the nature cure movement of Europe. In Scotland, Thomas Allinson started advocating his hygienic medicine in the 1880s, promoting a natural diet and exercise with avoidance of tobacco and overwork. The term sanipractor has sometimes been used to refer to naturopaths, particularly in the Pacific Northwest region of the United States. The term naturopathy was coined in 1895 by John Shiel, and purchased by Benedict Lust, the father of U.S. naturopathy. Lust had been schooled in hydrotherapy and other natural health practices in Germany by Father Sebastian Nape. Nape sent Lust to the United States to spread his drugless methods. Lust defined naturopathy as a broad discipline, rather than a particular method, and included such techniques as hydrotherapy, herbal medicine, and homeopathy, as well as giving up overeating, tea, coffee, and alcohol. He described the body in spiritual and vitalistic terms with absolute reliance upon the cosmic forces of man's nature. In 1901, Lust founded the American School of Naturopathy in New York. In 1902 he founded the Naturopathic Society of America, reorganized in 1919 as the American Naturopathic Association, ANA. Naturopaths became licensed under naturopathic or drugless practitioner laws in 25 states in the first 3 decades of the 20th century. Naturopathy was adopted by many chiropractors, and several schools offered both Doctor of Naturopathy, M.D., and Doctor of Chiropractic, D.C. degrees. Estimates of the number of naturopathic schools active in the United States during this period vary from about 1 to 2 dozen. After a period of rapid growth, Naturopathy went into decline for several decades after the 1930s. In 1910, the Carnegie Foundation for the Advancement of Teaching published the Flexner Report, which criticized many aspects of medical education, especially quality and lack of scientific rigor. The advent of penicillin and other miracle drugs and the consequent popularity of modern medicine also contributed to naturopathy's decline. Following Lust's death in 1945, the ANA split into 6 distinct organizations. In the 1940s and 1950s, a broadening in scope of practice laws led many chiropractic schools to drop their MD degrees, though many chiropractors continued to practice naturopathy. From 1940 to 1963, the American Medical Association campaigned against heterodox medical systems. By 1958, practice of naturopathy was licensed in only 5 states. In 1968, the United States Department of Health, Education, and Welfare issued a report on naturopathy concluding that naturopathy was not grounded in medical science, and that naturopathic education was inadequate to prepare graduates to make appropriate diagnosis and provide treatment. The report recommends against expanding Medicare coverage to include naturopathic treatments. In 1977, an Australian committee of inquiry reached similar conclusions. It did not recommend licensure for naturopaths. Naturopathy never completely ceased to exist, and beginning in the 1970s interest waxed in the United States and Canada. Today, there are 6 accredited naturopathic medical schools in North America. In 1956, Charles Stone, Frank Spalding, and W. Martin Blathing established the National College of Natural Medicine, NCNM, in Portland, Oregon in response to plans by the Western States Chiropractic College to drop its MD program. In 1978, Sheila Quinn, Joseph Pizzorno, William Mitchell, and Les Griffith established John Baxter College of Naturopathic Medicine, now Baxter University, in Seattle, Washington. The rise of the holistic health movement in the early 1970s contributed to this revival. Naturopathic ideology focuses on naturally occurring and minimally invasive methods, trusting to the healing power of nature. Such treatments as synthetic drugs, radiation, and major surgery are avoided, and rejection of biomedicine in favor of an intuitive and vitalistic conception of the body and nature is common. Prevention through stress reduction and a healthy diet and lifestyle is emphasized. The philosophy of naturopathic practice is self-described by 6 core values. Multiple versions exist in the form of the Naturopathic Doctor's Oath, various mission statements published by schools or professional associations, and ethical conduct guidelines published by regulatory bodies. First, do no harm. Provide the most effective health care available with the least risk to patients at all times, prima non nocere. Recognize, respect, and promote the self-healing power of nature inherent in each individual human being. This medicatrix naturae, a form of vitalism. Identify and remove the causes of illness, rather than eliminate or suppress symptoms, tell Corsum. Educate, inspire rational hope, and encourage self-responsibility for health, doctor, as teacher. Treat each person by considering all individual health factors and influences. Treat the whole person. Emphasize the condition of health to promote well-being and to prevent diseases for the individual, each community, and our world. Thanks for listening.